Hi there. Today's case involves a well-known OSCE scenario that calls for careful attention to specific patient signs and symptoms. I'll explain how to ask the right questions, and there are a few red flags that we'll be going through. If you notice any of these red flags or learn about them from the case, you should know that this patient will be a referral case. I'm going to give you a lot of advice today, so please stay tuned and thank you very much. Let's begin with the case of today.
I am super itchy down there, and it's really worrying me.
Hi there, I'm Luna, the pharmacist. Please have a seat in our counseling area. I want you to know that everything we discuss here is completely confidential. May I have your name and age, please?
My name is Samantha Harry, and I'm 28.
Thanks, Samantha. It's really important to get to the bottom of what you're experiencing. Could you tell me more about your symptoms?
I have discharge, itchiness outside, and it feels like there's this stinging, burning sensation.
I'm sorry to hear that. How would you describe the discharge?
It's like cottage cheese.
I see. Is there any smell to it?
No smell.
That's good to note. Any pain when you urinate?
No, thankfully not.
Do you have a fever at all?
No.
Is this the first time you've experienced these symptoms?
No, actually, I was diagnosed by my doctor about 3 months ago, and I had the same symptoms then. She prescribed me antifungal medication, and it really helped at the time.
I see. It must be frustrating to have them come back. Have you had a chance to mention these recent symptoms to your doctor yet?
No, I haven't.
I see. Just to check in, are you currently sexually active?
Yes, I am.
To make sure we give you the best care possible, could you share how many sexual partners you've had recently? It really helps us tailor our advice and treatment to fit your needs better.
I have one partner.
That's great to hear. It's nice to have that connection. Some people use products to clean or freshen up. Do you use anything like a vaginal douche?
I like to stay fresh, so I use a vaginal douche a few times a day.
Got it. I noticed from your profile that you were prescribed amoxicillin about 10 days ago. What was that for, if you don't mind me asking?
It was for a UTI.
Got it. And I see you're taking birth control pills, Alice. Are you still on those?
Yes, I am.
Good to know. Do you have any other medical conditions I should be aware of?
No, nothing else.
So, aside from the birth control pills, are you currently taking any prescription medications?
Nope, just the birth control pills.
Understood. What about any non-prescription medications? Anything over the counter?
No, nothing at all.
All right, thanks for sharing that. Any updates on allergies? It's always good to double check.
No changes there either.
Perfect. That's very helpful to know. Are you breastfeeding at the moment?
No, I'm not.
Okay, that simplifies things a bit. Do you smoke at all?
No, I don't.
Great to hear. How has your diet been lately?
Well, I've been really stressed, so I'm just grabbing whatever I can find.
I completely understand how that can happen. When life gets overwhelming, it's easy to let healthy habits slip.
Exactly. Thank you for your patience.
Of course. Based on what you've told me, it sounds like you've been experiencing recurrent vaginal candidiasis.
Why am I getting these repeated attacks?
It looks like there are quite a few risk factors at play. Using frequent vaginal douching, dealing with stress, being on oral birth control pills, and your recent antibiotic use, those can definitely play a role and can all increase the chances of recurrence. It can feel frustrating, but you're not alone in this.
That makes sense.
And it is important to know that regular douching doesn't have proven benefits and can actually cause harm. To stay safe, it's important to follow good advice and use the right products and methods. For now, I suggest using an antifungal treatment. Would you prefer the oral or vaginal option?
I think I'd prefer the vaginal.
Great choice. Here's what you'll do. Use the Canesten Vaginal Cream. The active ingredient is 1% clotrimazole. Use 1 applicator full daily at bedtime. This helps increase contact time with vaginal tissue. Continue using the cream for 7 days. And don't worry, you don't need to stop during your period. It's important to complete the entire course, even if you start feeling better before finishing it. For any outside itching that might be bothering you, I recommend using topical 1% Canesten cream externally twice daily for 7 days. Just a heads up, using Canesten, the vaginal or topical cream might cause an allergic reaction in some people. If you notice any unusual symptoms like itching, redness, or swelling, stop using it and let me know right away.
That sounds manageable.
I'm glad to hear that. And please, take care of yourself. Try to reduce your stress, eat healthier, and continue practicing safe sex. If things don't improve in 2 to 3 days, or if it doesn't resolve completely in a week, please reach out to your doctor. We want to make sure you feel your best. You might also be dealing with another infection, so I recommend getting professional assessment. Okay, that sounds good. Can I follow up with you in 2 to 3 days to see how you are doing?
Yeah, go ahead.
Thank you, Samantha. I'll check in soon. Remember, you're not alone in this, and it's okay to reach out for help. Take care of yourself.